and welcome back to my YouTube channel. You're on Orion Family Health's YouTube channel. I am Dr. Monica Bartoli. I am the owner and solo physician of Orion Family Health. For those of you who don't know, Orion Family Health is a direct primary care practice located in South Florida. I serve most of Broward and Palm Beach County, and the practice is designed to do house call care, meaning I go to my patients in their homes and take care of them in the comfort and safety of their own homes. So I would like to make a video about family medicine today. I am a family medicine physician, and I find that sometimes people, the general public, doesn't really know, what does family medicine do? What does that mean? So I thought I would make a quick little video describing it. So first of all, family medicine is a specialty. So after our 4 years of medical school, whether we're MD, DO, we have the choice to go to a residency or just to complete an internship. So family medicine is a full 3-year residency, just like internal medicine is. So after medical school, we go and complete our 3 years. And that training really consists of a wide variety of things. We do hospital work, we do emergency room work, we usually maintain patients in an outpatient clinic setting. And every month of those 3 years, we rotate through different specialties. So what makes family medicine unique and different from internal medicine is we are trained in what I like to call womb to tomb medicine. So we are equipped to be able to take care of people essentially from conception all the way to death. Family medicine doctors do a few months in those 3 years of pediatrics. We do cover OBGYN and deliver babies. Yes, I've delivered babies. We do a few months of each surgical specialty. So we do general surgery, orthopedic surgery, eye surgery, urology. And then we also complete the same specialties that internal medicine rotates through for the most part. We do a month of cardiology, pulmonology, critical care, endocrinology. We do some geriatrics. So really, family medicine covers the entire scope. What makes us different than internists, a lot of people ask me, well, what's the difference? Is generally speaking, internal medicine is not trained in pediatrics. They're not trained in OBGYN. And they're not really trained in in-office procedures. Now, I'm sure that varies through programs throughout the United States, and some internal medicine doctors who want to learn procedures, I'm sure, have the opportunity. But classically speaking, that's the difference between family medicine and internal medicine. The other difference is family practice doctors, we can go on to specialize in certain things. Some people can do an emergency medicine fellowship or a geriatrics fellowship. But if you want to specialize, a lot of people take that internal medicine route and then go on to specialize in cardiology or whatever have you. So family medicine doctors, we know a lot of things. We know a little bit about a lot. That's kind of how I like to put it. And jack of all trades, if you will. So I practice full scope. I have newborn patients all the way up to my 100-year-olds. And I really like procedures, and so I've made that part of my practice. Not every family practice doctor does that, but some people may not realize that family practice doctor procedures include things like skin biopsies. We do laceration repair, or stitches as most people call them, IUD insertions. I did a lot of those in my last practice. We do joint injections, and some of us osteopathic doctors do manipulation. So there's a really wide variety. Some old school doctors do vasectomies. I used to work with a family medicine doctor back in Colorado who did vasectomies, and I just thought it was the coolest thing. So we are your jack of all trades, your traditionally trained doctor, if you will, and we're capable of handling basically pregnancy all the way through death. Now, we all have a niche, I find, in family practice. Even though we do a wide range of things, some of us hone in on our niches. So for me personally, even though I practice full scope, I love geriatrics. That's one of my passions. I love procedures. I actually got to do a toenail procedure this morning for somebody, and those are the things that really get me excited. And I love patients who don't fit in a box. Those people who just don't feel good. They've been maybe to multiple doctors and they just can't feel right. I love learning about integrative approach to them, and really trying to help people's quality of life. So those are my niches. When I was in a different practice that was office-based, I did a lot of gynecology as well, and I did enjoy that, things like IUDs and pap smears and stuff like that. So what can family practice doctors do? What if you're a patient that needs a doctor and you don't know where to start? Who should you see? Should you see family practice? Should you see IM or internal medicine? Should you see a specialist? And really the answer to that is it depends on what your issue is. But if you're just starting out, or you don't have a diagnosis, or you do have a diagnosis but you don't know where to go, a family practice or internal medicine doctor is a great place to start. You don't always need a specialist for everything. And that goes back to our training, where we go through different specialties to be able to learn how to handle different things. Do you need an endocrinologist for your insulin-dependent diabetes? No, you don't. I only consult endocrinology in the setting of diabetes if my patients need an insulin pump, because most of the insurance requirements include having an endocrinologist, or if I'm trying them on 3, 4, 5 medicines and we're not really getting anywhere. But again, most of those cases are actually because the patient's not making the lifestyle changes more so than the medicine not working. Do you need a cardiologist for your high blood pressure? The answer is no. If you have simple high blood pressure, no other cardiac issues, your internist or your family medicine doctor is more than capable of handling those things. Now, some patients, if they have cardiac history or something else going on, I'll utilize their cardiologist for a visit once a year, or to interpret some testing we do. But just at the basics, family practice and internal medicine are more than capable of handling your high blood pressure. What about joint concerns? Do you need an orthopedic surgeon? The answer is probably not, unless you need surgery. And that is no hate to my orthopedic surgeons at all. But a lot of patients don't realize their shoulder pain, their knee pain, their arthritis can be managed effectively by a family practice doctor. We do joint injections, so we do the same injections that your orthopedic does. And we can offer them at much lower cost and less waiting time to get into the office. Do you need a gynecologist for your pap smear? If you're not trying to get pregnant and you don't have any complex history, the answer is probably not. Most family practice doctors do pap smears in their office. Some even do colposcopies, which are biopsies of the cervix if needed. So before you run and jump to a specialist or assume that's what you need, I encourage you to look around your area, talk to some primary care offices, and see if what you need is within their scope, because it will save you money and it also save you time. You can usually get into a family practice or IM office a little faster than going to see a specialist. So I hope you learned a little bit about what family medicine is, what it is that we do. I love family medicine. I chose it as my specialty because I love that every case is different. I get a variety of things. I love procedures, but it cannot be in an operating room for more than an hour. So it was a perfect blend of all the things I love about medicine. If you have any questions about family medicine, direct primary care, what we do as a whole, what I do in my practice, feel free to leave me a comment, send me a message. You can visit my website, www.orionfamilyhealth.com. That's Orion like Orion's belt, the constellation. And I look forward to sharing more information to educate people about what it is that I do, what it is that family practice doctors do, so that we all can get on the same page when it comes to your care. Thanks for tuning in, and we will drop more content soon.